have invested hugely not only in the equipment can be brought by anybody, but bringing that expertise, bringing the surgeons, bringing the nurses who can operate this equipment matters a lot. That's what we have done for many years. If you look at this CABG, we call it as bypass procedures, we have started long back, even before other hospitals knew that it can be done. We started 10, 12 years back itself, and we are leading the country in terms of numbers in these kind of procedures. So robotic surgery is one area where Apollo Hospitals is still leading the country and many of the countries around the world. Second thing is cancer therapy and cancer procedures. If you take, we have the proton facility, which is the only facilities available in the country. If you take any transplantation, including bone marrow transplantation, we are leading the country. And any other cancer therapies, whatever you name it, it's all available in Chennai. So that can be number two, where we ourselves differentiate from the rest of the people in the country actually. So we are leading the area. And then bringing in newer technology, kind of artificial intelligence, whether it's a genomic therapy, we always becoming the pioneers in terms of bringing in all these newer therapies. So we always offer these kind of services to people in West Bengal and around the country. And whether you take heart transplant, lung transplant, bone marrow transplant, liver transplant, all these surgeries are very, very complex surgeries. Apollo Chennai is still leading the country. That's the reason we get more than 15,000 patients. People travel from Eastern India, Northeast and West Bengal. More than 18,000 people travel to Chennai to get treated. Of course, for the period of time, that number should come down. We want to develop the service locally, but until then, we are there to help people of West Bengal. And I want to once again thank all of you for being here. Thanks for trusting Apollo Chennai. And I really request you to take this message to people, because pioneering in technology, adapting newer technologies, bringing in newer skill set, always being the leader in any field of medicine, Apollo Chennai always does it. Thank you for being here. I'm happy to take questions. I'm sure if you want them to speak in Bengali or Hindi, people or my colleagues can speak. Thank you so much. সেটা অ্যান্সার দেবেন স্যার। The existing facility, lot of new services are getting added each and every year. There are still plans to expand, bringing in the newer facilities also. Maybe we can announce it once it's firm, more firm. Of course, we wanted to develop a healthcare facility, offer all the services in West Bengal itself. We don't want patients to travel to other locations. That's one of the top priorities.
So you have talked about the robotic surgery. Do you have any people of
I don't know how many robotic machines are available in Kolkata. The thing is, to do all type of robotic procedures need a huge expertise. It's not only the doctors, we need a full team to have that expertise to operate. That's what I always say. If there are 100 types of robotic procedures, I'm sure there are number of procedures are done in Kolkata itself, but out of 100, all 100 will be done there. You understand? I think that's the difference. I'm sure in a few years' time, I don't know how long it's going to take for all 100 types of robotic surgeries to be done in Kolkata. That will happen at some point of time, but until then, we are there to help people.
मेरा मन में एक क्वेश्चन आता है, अगर यहाँ पर अपोलो है तो चेन्नई जाने का क्या ज़रूरत है?
सर, जैसे डॉक्टर ने बोला था कि अगर 100 तरीके के प्रॉब्लम्स एक पेशेंट को होते हैं, तो उन 100 में से 95% का प्रॉब्लम का सोल्यूशन हमारे पास कलकत्ता में ही है। कुछ ऐसे 5 हो सकते हैं जिनका हायर फैसिलिटी का जरूरत पड़े, उन चीज़ों के लिए पेशेंट्स हमें ढूंढ के चेन्नई आते हैं।
कलकत्ता में 5% क्यों नहीं आप लोग इस्तेमाल करते हैं और ज़्यादा?
अभी हमने शुरू किया है ये, अगर आप देखोगे अगले 2 या 3 या 4 सालों में ये जो 5% जो हम लोग वहाँ कर रहे हैं वो यहाँ पे भी होगा
ना?
पक्का होगा।
I can share some more example for your question. For example, 10-15 years ago, out of 100 patients, only 50 patients would have got treated, 50% would have come to Chennai. Now, if you look at the same number, out of 100 patients, 80-90% of the patients are getting treated locally. Only 10 patients are coming to Chennai. That's how that the medical field and healthcare field is growing very fast in West Bengal and Kolkata. I'm sure in few years' time there is no need for any patient to travel anywhere outside West Bengal. That should happen. That's what happened in Chennai itself. If you take 15-20 years back, if a patient needs a transplant surgery, they have to go abroad. They have to go to UK or Singapore. Now, 15 years later, the same Chennai, none of the patients need to go out of the state. Not only that, we are getting a lot of patients from multiple other countries. I'm sure the same thing will happen in West Bengal, also in Kolkata, in few years' time. I think that's how the evolution happens in the medical field in each state. And Kolkata is not at all inferior to any other state or any other city. And Kolkata is growing like anything. When I was walking in the city this morning, I can see that there's a lot of similarity between Chennai people and the heritage, culture, history. It's almost similar. Even the intelligent people, I'm sure there are a lot of doctors who are all my friends. They have all developed a huge development in the medical field. I'm pretty confident that Kolkata is not at all inferior to any state in this, any city in this country. I'm sure they will develop. You don't need to travel outside Kolkata very soon.
अच्छा मेडिकल एक्सपेंस कलकत्ता चेन्नई की सेम
Medical expertise, that's what I'm trying to say. If you expenses, I would say, for high quality care, very high quality care, high-end treatment, there is a cost comes with it. If you want to get the same kind of treatment in Kolkata, the cost will be same. That's what I can put it across. You understand? If for example, if you have a cup of tea, the tea prices varies. How they serve, who serves, which ambience they serve. You understand? There is a quality check, quality control. The same tea, I'm talking about just 30-40 milliliters of tea. The price can be 5 rupees, it can be 500 rupees, it can be 1500 rupees. You understand? Maybe 1500 rupees for a cup of tea is too much, but anywhere around 100 to 150 rupees, we all accept that because it comes with a quality standard. I think if you are expecting a quality, we have to pay that price a little bit. Thank you.
Thank you. Thank you.
Sir, can you tell?
I can talk about any robotic surgeries. There are a few things people should understand that. First of all, put effort to identify the disease well in advance. Even if you look at our chairman, whenever I walk into Dr. Pratap C. Reddy's office, even today, the first thing he will talk about is, he will not say that bring patients for treatment. He will say, go to people, advise them to do the preventive health check so that they can identify the disease well in advance. That's the main thing he can communicate to us. That's what we wanted to propose. For example, I'll quote you some example. Breast cancer, yeah, in women. I'll come to robotic surgery a bit later. Breast cancer in women. Breast cancer is one of the most commonest cancer in women in India. All of you know that. I'm sure many of your friends or any of your relatives, I'm sure all of you will have one incident in some circle, maybe closer circle or distant circle. Somebody died of breast cancer. Why should they die? Because of ignorance. They don't know that they can get some tests done a bit early, they can identify the disease so they can get completely cured out of the disease. Unfortunately, in India, most of the breast cancers we are able to identify only in stage 3 or stage 4, which is quite late. Still, we are able to give a surgical option, we are able to give radiotherapy option, but in case of the patient, we are able to pick up the patient in stage 1 or stage 2, the cure is 100%. If you come to robotic surgeries, I would say the outcome is excellent, unbelievable actually. And that's the reason we bought the 3rd robotic machine in Apollo Chennai Grimsword Hospital itself. That's the only hospital, to my knowledge, in southern India to have 3 robotic machines mainly for this kind of surgeries. Not too many hospitals will have this kind of investment or technology to be done for robotic surgery. So we primarily focus on robotic surgeries for better outcome.
But it's how much cost